This is WFYI News Now. It's August 7th, and I'm Abriana Herron. On today's show, a new alliance urging lawmakers to revise the state's charity gaming laws. We talk to an expert to find out why wildfires in the north aren't impacting Hoosiers as much as wildfires last year. And a new effort in Indianapolis to reverse drug overdoses inside people's homes.
In general, I think the best way to prevent overdoses is to kind of saturate the community where we know overdoses are occurring with naloxone.
Those stories coming up, but first, Hoosiers can now get an idea of how individual medical procedures cost in Indiana, including average prices at various hospitals. Indiana Public Broadcasting's Brandon Smith reports on the launch of the All-Payer Claims Database.
Lawmakers directed the Indiana Department of Insurance to create the database 4 years ago. The agency last year partnered with On Point Health Data, a company based in Maine, to build the site before finally launching it now. The database allows you to choose from a list of medical procedures, select a health insurance provider and your zip code to find the average cost and out-of-pocket expenses for the procedure. The site also includes a quality rating for the healthcare facilities. The data is still limited. Information on certain procedures isn't available for each individual insurance provider or each individual hospital based on insurance provider. But Department of Insurance Commissioner Amy Beard says the database can be an invaluable tool in helping consumers make data-driven decisions. For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
You can find a link to the database on our website. And Indiana veterans organizations want to be able to offer an electric gaming option at their posts. A new alliance is urging lawmakers to revise the state's charity gaming laws. Currently, veterans groups like the American Legion and the Veterans of Foreign Wars can offer paper pull tabs. Pull tabs are a kind of lottery game in which you pull off strips of paper to reveal numbers, letters, or symbols underneath. Match enough up and you win. VFW past State Commander Richard Lair says the groups now want to offer electronic pull tabs, whether on large machines or on tablets.
So you don't have the paper to handle, you don't have the cash to handle, everything's done electronically.
Lair says veterans groups need a boost that electronic charity gaming can provide.
Right now, most of our posts are older. I mean, the average age is probably in the high 60s, and we need to get the younger members in.
Veterans organizations use money earned from charity gaming to donate to causes around the state. Last summer, smoke from Canadian wildfires caused several days of dangerously unhealthy air for Indiana. But as wildfires are still burning up north, the smoke hasn't been as bad for Hoosiers. Indiana Public Broadcasting's Rebecca Thiel talked with an expert at the National Oceanic Atmospheric Administration, or NOAA, to find out why.
Eric James works for NOAA's Global Systems Lab, which helps develop models to predict weather and air quality. He says you need a lot of fires to get really bad air quality in a place far from the source like Indiana, and last year more fires were active earlier in the season.
I remember last year there were lots of really big fires even in May and June. This year the fire season seems to be a little bit later to get going, so it's very active.
James says wind patterns also haven't consistently brought that smoke to Indiana like they did last year. He says with Canada in a long-term drought, we'll probably see the smoke affect Indiana for years to come. But how much could vary from summer to summer. For Indiana Public Broadcasting, I'm Rebecca Thiel.
NOAA has a new tool that shows smoke forecasts across the U.S. We'll have a link to that on our website. And for our final story today, Indianapolis Emergency Medical Services will now leave behind medication to reverse drug overdoses at the house of someone who has overdosed. That could mean leaving the medication with the person who overdosed or with a bystander, friend, or family member. WFYI's Ben Thorpe has more.
According to Marion County health officials, there are between 5,000 and 6,000 non-fatal drug overdoses across the city every year. A majority of those overdoses will take place at a person's private residence. And experts say that drug overdose survivors are at a higher risk of experiencing a future overdose. Naloxone can reverse an opioid overdose and save lives when administered in time. Here's Andrea Bohenik with the Marion County Health Department.
In general, I think the best way to prevent overdoses is to kind of saturate the community where we know overdoses are occurring with naloxone.
In addition to naloxone, the kits that will be left behind by EMS workers will include both educational materials and the number for an overdose lifeline. I'm Ben Thorpe.
If you or someone you know is in crisis, you can call, text, or chat the Suicide and Crisis Lifeline at 988. That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.